We're going to perform a Synergie layered peel. The layered peel looks at peels in quite a different way, and what we do is we first layer salicylic acid, which is your beta hydroxy acid, or a BHA, and then over the top we layer the AHA, the alpha hydroxy acid. Typically beta hydroxy acids, or salicylic acid, is lipophilic. It likes oil, so we put that on the skin first, and that goes deep into the follicle and it pulls out all the debris and dead cells inside the skin. On top of that, we then lay the lactic acid component, or your alpha hydroxy, and that works more on the surface of the epidermis to remove any dead skin cells trapped on the surface. So we do this typical layered peel, particularly for dull, lifeless skin in need of exfoliation, also for acne and congested skin, and even for sun damaged and aging skin. 2 weeks prior to the treatment, we do recommend the client uses our trial kit using vitamin A, B and C, and of course Uberzinc. And if they have acne, they can also use decongest and exfoliate with exfoliating serum. And of course applying our lightening serum to minimise any risk of post-inflammatory hyperpigmentation. We recommend 1 treatment every 2 to 4 weeks, and 4 to 6 treatments are recommended. The AHA solutions vary from anything from the 20% lactic right up to the 60%, and the BHA or the salicylic we begin at 5% and go up to 30%. We do recommend using the 5% lactic as your workhorse peel level. It's very effective and it's also not too irritating on the skin. Again, with the lactic, don't start with a high level, work your client up to the higher levels. And let's begin the peel. So the protocol, firstly, we will explain the procedure to the client and gain a consent. This is a very, very important part of all Synergie procedures. Always have your consent form ready, and Synergie does supply a peel consent if you should need one. Okay, so we're going to start using Synergie Ultra Cleanse. First of all, we emulsify the Ultra Cleanse with water, and then we apply directly to the face. Often it's better to use your hands, your gloved hands, because you do get a lot better coverage over the skin. Now we do like to use 2 gauze, and we fold them quite thoroughly into small squares, and that gets a really thorough cleanse. We prefer to use the fine gauze, the coarse gauze, not the fine gauze, because it is a little bit more abrasive on the skin. So we wash with water, and we put this gauze into our small squares, and we begin cleansing. Now we start cleansing on the jawline, and that's the client's area of concern, and we then move in small circles. Now it's important to be quite firm at this point, because we want to use small circles to be firm on the skin, and as you can see, we're working around the skin. And we also work around the nose, and that helps to remove the blackheads, which is often an area of concern, and obviously using gauze gives a better cleanse. And you can actually see the amount of makeup that comes off Jess's skin, and that's just with 1 cleanse. It's quite significant. Then we actually use Fibrella or daily towels to actually remove the final amount of cleanser. Now often we may repeat, we may do 2 cleanses, we may even do 3 cleanses depending on the client's needs. Now we can see how effective the cleansing is. We're actually going to commence a 2nd cleanse now. So we're going to do 2 pumps of cleanser, of Synergie Ultra Cleanse plus your water. And we're actually going to use our fingers to apply that to the face. Now, you can use gauze to apply the cleanser to the face, but often it's better to actually use gloved fingers, because you can feel the area of congestion on the face, and you can really feel where the areas are that need addressing. So it's optional to use gauze or gloved fingers. So we're applying the cleanser on the face. And then we're going to do the second cleanse with 2 pieces of gauze. And we're going to take our gauze, fold it into small squares, squeeze out the excess water, and the face is emulsified with cleanser, and we're really going to use our small circular actions to draw out the impurities and actually remove areas of congestion. Now, this is actually like a mild exfoliation. We're actually going to increase the penetration of the peel, because if we're getting off the layers of dead skin, we're actually going to get a better result. Now, you will notice that the client's skin will appear brighter and her circulation will be improved. You'll get increased erythema, and that will again aid the uptake of the peel. Now, if you are still picking up makeup and grime at this stage, then you can perform a third cleanse. Generally 2 are sufficient, but you need to make sure that your gauze is clean, or else you will have to do a third cleanse.
So last slide again.
We do need to make sure that the gauze is clean, or else you will have to perform a third cleanse. Now, we know that oil will impede the penetration of our peel, so one of the main reasons peels fail is because of oil on the surface of the skin. So educate the clients to know the importance of cleansing, and also make sure that you cleanse your client's face properly prior to your peel. And that's our cleanse. Now for the degreasing step. This is a very important part of the step. We're going to be using Synergie Skin Prepare. This may sting a little because the patient's just had a thorough cleanse and there's a little bit of grain-based alcohol. So we're going to begin on our gauze, firm strokes along the jaw, along the cheeks, and up the nose, across the forehead, again down the sides of the face, and we finish under the jaw. How's that feeling, Jess?
Good.
Any stinging?
No.
Okay. Now we wait till any erythema or stinging subsides, and then we apply our peel solution. Now, choosing peel levels are very important. We always obviously start off with salicylic. 5% salicylic is one of the most popular entry-level peels. It's a beautiful peel. It can be used on virtually any skin type, even your high Fitzpatrick's. It's terrific for decongesting the skin, for the nose area, for getting rid of blackheads. It's literally the bottle brush of the pores because it works deep within the follicle to pull out all the debris. You can even layer the salicylic, and you'll get great results with minimal inflammation. So what we're going to do is put a capful of our salicylic into our dish, and we are going to apply that to our cut gauze in manageable sized pieces. So the gauze won't be soaking, but it'll be decently wet with the peel. Dipping our peel into the solution. Remember, salicylic is oil loving, it's lipophilic, and that's why we always apply salicylic as our first layer, because it likes the oil. So we apply it evenly. We do not double pass any peels. Firm, even pressure. Be careful not to overlap. And we start at the most congested areas and work to the least congested areas, starting from the inside, working out along the nose, across the forehead, into the hairline, single wipes, and then under the chin. Now, from a scale of 1 to 10, Jess, how would that be feeling on your skin at this time?
Yeah, good. Feels about 3.
Okay, so we're just going to wait for any tingling to subside from the salicylic layer. And we're just going to begin applying the lactic layer very soon, but we have to monitor the patient before we apply the next layer. So we're just going to look at frosting, also seeing if there's any area of a white chalky appearance. That can be very normal. It's just a reaction between salicylic acid and the keratin of the skin, but we need to know that that's subsided and that's removed before we apply the next layer. So how's that feeling now, Jess?
Yes. Yeah, good.
So now we're applying the second part of the lactic peel, or the second part of the layered peel. This is the lactic acid part, and this is the hydrophilic part. So we're using lactic acid 20% here, And this is a fairly low level lactic, but we have laid that over salicylic. So we are doing a serious layered peel here. We saturate the gauze with our lactic acid, again using 1 capful of lactic acid per pass. We can use a brush with this if you like, but we do prefer to use gauze because you can get even pressure. Put the lactic acid on the gauze and pass over the face. Again, single passes, firm strokes, don't overlap. Start at the chin and wiping up towards the centre of the face and up to the top of the chin, down in the jaw area, and again, no double passing. We leave the top lip till the very end because this can be quite a sensitive area, so we're just gently going to wipe over the top lip. And if we are using very high level peels, for example, we might go up to Salicylic 10 or even Lactic 30, 40 or 60, we must be very careful and monitor the client using occlusiderm on the sensitive areas, the corners of the lips and under the eyes, and also where the clients have had tattoos. Never start a peel series on high-level lactics or salicylics. Always start them low and monitor the patient and work up as they do the series. Never prepare a peel over the top of a client's face. That's very dangerous because the peel can drip into the client's eyes. Now, that really is the double peel. Very simple. How's that feeling now, Jess?
Yeah, good.
Any stinging?
No.
And there you have it. That's the Synergie layered peel, salicylic, followed by lactic acid. So following the peel, we then apply our post-care routine. Obviously, we use the ICU gel, and that's going to be very cooling and calming and anti-inflammatory. We just pat that into the skin, and that will calm any erythema down, allow that to penetrate. And then, of course, we apply our sunblock, our Uber Zinc, 21% zinc oxide, and we don't allow the client to leave the premises without sun protection or even a hat on, but particularly Uber Zinc. So we just pat that on the skin. And obviously, if there is any erythemic response, then we have to have our bicarb and water handy. Always have that if there is a severe redness. Monitor the skin closely, and you saturate the skin with your bicarb and water solution. Always have that handy. It does only last a week, so you have to refresh it. So in terms of additional products, we don't advise you to use any additional products apart from your anti-inflammatories, your ICU, your Uber Zinc or your occlusiderm for the next 24 hours. Within 48 hours, you can apply vitamin B because that's a lovely, soothing and not a highly irritating ingredient, obviously, niacinamide. But then when the inflammation has settled and there's no sign of redness, we can resume our high-level actives such as our vitamin A and our vitamin C. Now, obviously with peels, with higher level peels, you may get some swelling, you may get some skin redness and erythema around the face. We need to monitor that, and you may also get flaking. Now, this will subside, but the best way to address the flaking of the skin during the shedding phase is either by using Remedy Balm, which is occlusive, or your occlusiderm, which is highly occlusive. So light flaking, probably the Remedy. Severe flaking, you'd probably use the Uber Zinc, the occlusiderm, pardon me. Now, there are some contraindications to using the peels. Firstly, remembering that salicylic acid is part of the aspirin family. So if you have an aspirin allergy, you should not do a salicylic peel. Also, if you're pregnant or lactating, you are not to use salicylic. And obviously, if you've been on Roaccutane in the last 6 months, we do not recommend you have peels at all. We do not recommend you apply peel over irritated skin or sun-exposed skin, or if you have active herpes lesions on your lips. And also building up your level of peels. This is really important to note. You have to know your skin, okay? You have to know how strong to do the peel, and you would never do a strong peel on a client as an initial peel. Always err on the side of caution with Synergie, okay? So you can increase your layers, you can increase the strength of the peel. I would always start with a low-level salicylic, always 5 or the very highest a 10. We don't tend to go up further than 20% in salicylic. If you're a doctor, you can go higher than 20. And again, We wouldn't go higher than 40 generally with lactic, and again, doctors only can go 60. Make sure that you manage the client and you'll have a great result. And that's our layered peel. Thank you.